Hey everybody, it's Lisa from Lisa Bug Fitness and Yoga with Straight Talk on Knee Replacement. And my topic today is the CPM, or Continuous Passive Motion Machine. And this is just my experience with the CPM, just to give you an idea maybe if you're thinking about whether you need to have one. Back in 1985, I had a ACL reconstruction surgery. And it was just before Christmas. So they put me in a range of motion limiting brace, and I was not able to get into physical therapy for a couple of weeks after the first of the year. By that time, my knee was extremely stiff, and I scar very quickly and easily, so the adhesions or scar tissue had started to form in my knee joint. So I was trying to get my knee to bend and really struggling with range of motion. A couple of times the physical therapist rolled me over on my stomach and forced my knee to bend and just cracked off some of those adhesions. Really painful. Eventually, after not gaining my mobility, they put me under anesthesia and did what they call a manipulation under anesthesia, or a MUA, M-U-A. And when I woke up from that procedure, I was in a CPM, which bends your knee back and forth while you're laying down. They sent me home with that and told me to spend several hours a day in the CPM. That's what finally helped me get my range of motion back. And after several months, I was able to bend my knee all the way to bring my heel back to my butt. So now, fast forward, 4 months ago, I had knee replacement surgery, and I was struggling right at the beginning getting my flexion. This was, of course, due to a lot of swelling. It's not scar tissue right away. It takes a little bit of time for that to form. But knowing what my history was before, I asked the physician's assistant if I could get a CPM. And he said, we don't really use those anymore. I asked him why, and he said because most doctors feel that folks will just lay in that machine and they won't be actively mobile. They won't get up and walk. They won't do their strength training and other exercises. And I said, I promise I will do all of my exercises, but I'd like to order a CPM knowing what happened in my past. He said, you know your body, you know your history. I'm not going to say no. So he ordered one for me from my medical supply dealer, and I got it the next day. My flexion at that time was about 70 degrees. Within a week, I had bounced up to 100 degrees flexion, and within a few more weeks, actually my insurance paid for it for 7 weeks, I exceeded 120 degrees of flexion. So I feel that that made all the difference in the world for me. So really the takeaway from this is to advocate for yourself, to know your own body, to ask your doctor questions, to seek out the things that you think will be able to help you in your recovery. And if a CPM is one of them, it might be difficult to find one. They're just not as, they don't make them as much anymore. I had quite an old machine, but just advocate for yourself and ask for those things you need. Stay on top of your recovery. All right, everyone, if you have any questions on this, send me a comment below. Make sure you're subscribing to my channel so that this information can get out to those who really need it the most, those with total knee replacement. I'll see you next time. Stay strong, knee warriors. Take care.